Mark Gibson here. I'm the director of the Air Quality and Exposure Science Group at Air Photon, and I just wanted to make this little instructional video about public health and health worker PPE during this trying time of the COVID-19 virus. So a lot of custodians, ancillary staff, pharmacy staff, grocery staff, pizza delivery and so on, they're now looking at wearing some kind of respiratory protection for themselves, but also for the customer or patients in hospitals. And a lot of these people have not had the adequate training for wearing respirators or face masks. So they may be wearing them inappropriately. And I've actually seen this on social media, on the TV, that a lot of workers, indeed some hospital workers, healthcare workers, are not wearing that respirator mask correctly. So I just wanted to put this informational video, guidance video out there so you had a better understanding of how to wear those respirators. Now, if in the workplace you have to wear a respirator to protect you from any exposure to air contaminants, you actually have to undergo a fit test. So the US Occupational Safety Health Administration, OSHA, they have a standard 1910.134, Appendix F, subsection 2, which goes over the entire fit test process. And that's important because if a respirator doesn't fit you, it is absolutely no use. So that fit test is done on a yearly basis for those workers that require to wear a respirator at work. Now, because of the acute crisis with COVID, OSHA have actually relaxed that requirement because, of course, they're bringing in retired health workers. There are more people working with respirators. There's not enough time to get those fit tests done, but that must be done as soon as possible. It is incredibly important for that worker to help you be prevented from getting sick. So that was the main reason I put this little video together. So just to talk about the various types of masks or respirators out there. So you've seen the surgical masks. These are the green ones that go on your face. They're not a tight-fitting respirator, okay? They're a mask, and they really only protect people around you if you cough or sneeze, and those aerosols come out, which are contaminated with COVID. So the most basic one is this nuisance mask. So these things you'd wear if you're cutting the grass, sweeping dust, that kind of thing. They're not a respirator. They are not an N95 rated mask. They do offer some protection to the public. If you cough or sneeze, it'll be captured by this mask. Now, you've all heard a lot about the N95 mask, and you obviously want to buy a mask that is N95 rated, such as this one, and make sure it's a NIOSH approved N95. It'll also have it on the mask, okay, N95. There are two types of these. This is the one with no face valve, okay? So this protects you and it protects anyone around you from your cough and sneeze droplets that may have COVID. There are ones with valves in, and these are to make it more comfortable for the wearer. And the reason for the valve, when you exhale moisture. They don't get as hot, and it's more comfortable to wear. However, if you're infected with COVID, if you exhale, or you cough or sneeze, those droplets will come out of that valve and potentially could infect people around you. So just bear that in mind, what type of mask you have, who you're interacting with, okay? So the way these masks work is that this filter material it's a woven fiber, and the fibers are statically charged. So just like when you rub a balloon on your sweater and it gets that static charge and you stick it on the wall, that's one of the mechanisms that, how the particles are trapped into this filter medium. And the other way is simply through impaction. So as the particle is trying to make its way through that weave of fibers, the particle will impact on a fiber and stick. So that's two ways that these remove solid particles and liquid droplets from the air you would inhale. So to put one of these masks on, or donning a mask, and doffing is taking off the mask. So you put it gently onto your face, and then you pull the two elastics onto the top of your head, and then the bottom elastic you pull down to the back of your neck, and making sure that top elastic is toward the top of your head. You don't want these elastics to be twisted, and you don't want them crossing over at the back, okay? And then just ease that down slightly to the top of your nose, bridge of your nose. The next step is to mold this metal strip to your nose and your cheeks, and you just push that down. Don't nip it. Use both hands to gently mold that to fit your nose and the top of your face there. Okay. Now, before you go into the work environment where there may be a risk of inhaling COVID-19 cough and sneeze droplets, you want to do a seal check. So the way you do that is to put your hands over the filter mask and you exhale, okay? You shouldn't feel any air coming out of the mask, and it may even bulge slightly. And that felt good. I didn't feel any air coming out. The next step is to inhale, and you should feel the mask compress slightly. And it did. I could really feel that compressing. So that now tells me this has got a good seal on my face. Don't confuse a seal check with the annual fit test. That's done by a professional who will come and do a fit test on you with a number of different respirators to make sure you choose the right one. So this is a personal seal check that you should do every time you go into a potentially contaminated environment. Okay, so you finished your shift. You now want to remove this mask. So what you do, you tilt your head slightly forward and take the bottom elastic. So you're not touching this front piece. This could be contaminated with COVID-19 droplets. So take the back, pull it over, then take the top and pull that over and let it fall off your face, okay? And that way you're not allowing this mask to touch your clothing. You're not touching the front with your hands. It could have had cough and sneeze droplets on it, which obviously you're then contaminating your hands. So then you would dispose of this according to your workplace disposal protocols, or if you're at home, you might have a solution of bleach, pop it in there, and then just shake it off and dispose it in the regular garbage. Okay, so that's the N95 filter mask. So I now want to talk about the next level up in terms of respirator protection. So this is the half-face mask. This is a negative pressure mask. So when you inhale, there's a negative pressure and the air is sucked through a filter cartridge. Now you may see these filter cartridges have different codes on them. In fact, they will have different codes. You may see N100, an R100, P100. Now the 100 refers to its ability to remove particles in the air down to 0.3 microns. And 0.3 microns is very, very small particle or liquid droplet. To put that into size context, the average human hair is about 80 microns. So very, very tiny particles. these filters, when they're say 100, means they can scrub 99.97. So they're virtually 100%. So that's what the 100 is saying. Versus N95, which is obviously about 95% of the aerosol in the air is scrubbed out of the by the filter. Now the P designation, so P100, that works in both oily aerosol environments like spray chambers, garages, as well as normal environments. So it's oil proof, if you like. And then there's one in between, it's an R, so you may see R95, R100, and that is somewhat oil resistant. So that's what the N, R, and P are. So you commonly see N95s, N100s, or P100s. If you're not sure, get a P100, okay? That covers all aerosol types in the air. So P100 would work fine. This one has other, a sandwich of other cartridges in here for organic vapors from spray painting. It doesn't matter, that's fine. It's still got the P100, so that will protect you from any droplets that contain COVID-19. These are called elastomeric masks as well because of the elastic. The other important detail, just make sure the mask is not damaged, that these elastic parts aren't twisted. Check the seal, make sure there are no tears in it. Check that the cartridges are on correctly. You should always do that. The mask should be clean and sterilized when you take it out of the bag, okay? And that I'll come on to that later. So, take one of the elastic straps, take the other elastic strap, okay? This is for the back of the head. Place it on the back of the head, okay, and then bring it up onto your face. I'm gonna try and talk with this on my face, so I do apologize. Then pull this one on top of your head. So this piece is on the top of your head, and this piece behind, okay? So position it comfortably, and the first thing you do is a seal check, okay? So you must always do a seal check before you go into an area where you may be exposed to COVID-19 or other air contaminants, okay? So it's on your face. First thing is you cover up the exhalation valve, all right? And then you breathe gently, not really hard, just gently. And you should feel this expand slightly, the rubber here. If you feel any air coming out, it's not sealed. Now I felt a little bit, so I'm just going to tighten this up. So close your eyes, just pull that a little bit. And try again. Perfect, okay? So this is sealed in terms of blowing out. Now for inhalation. So I cover up these inlets of these cartridges. And you clearly saw that this rubber depressed because of that negative pressure when I inhaled. So that's good. I didn't feel any air coming in around the side. So this respirator, this mask is now ready, and I can now go into the workplace. Now, another route for COVID-19 is droplets landing on the eyes. So I would recommend also wearing goggles, all right? And that will give you the extra protection of any droplets landing on your eyes. And again, when you're doffing, take that off, and let it fall off your face, okay? Now, it's very important that you're clean shaven, because if you have stubble or a beard, that's going to break the integrity of that seal, and you could probably inhale particles if you're not clean shaven. There's another type of face mask, which is the full face. So again, similar tight fitting rubber mask. It goes around the chin and it goes right up to here, and it has a face shield. So you're getting both the respiratory protection as well as the eye protection. Okay, a little bit about the maintenance of these. You can wipe these with soap and water, and then you can get some sanitizer, put it on a towel, and wipe the outside. Get another sanitizing towel, wipe the inside, and if you like, you can repeat that process a few times just to make sure it's completely sanitized. Now, try not to get, if you want to reuse these, try not to get sanitizer inside. You can wipe that plastic surface, okay? Make sure you wipe all parts of this. And then you should have a bag that you would place this in. So you place them in a Ziploc bag, tighten that bag, zip it up, put your name on it, put your date on it, because that mask fits you. It may not fit one of your other family members. In fact, you probably don't want to be sharing masks for obvious reasons. So I hope this video is useful to you. And again, I'm Dr. Mark Gibson at Air Photon.